Good afternoon. My name is Adrienn Kovács, and I'm going to present my 6-month progress from the field of ketosis-prone type 2 diabetes. This form of diabetes is characterized by unprovoked ketosis onset with negative autoimmunity markers and with preserved insulin secretion, which means preserved beta cell function, which can be measured by the C-peptide level. There is no doubt that during the acute phase of this form of diabetes, patients need insulin. But in the long term, they may not need multiplied daily insulin injections. So my vision is that unnecessary insulin administration should be decreased, and it leads to my mission, which is to increase awareness about ketosis-prone type 2 diabetes. I have two specific goals, two projects. The first one investigates the prevalence and the clinical features of this form of diabetes, and the second project is a long-term follow-up cohort study from Hungarian patients' data. Let me start with the first project. Until 2019, when it was introduced by the WHO, ketosis-prone type 2 diabetes had not been properly classified. The aim of this first project is to assess the prevalence and to analyze the clinical characteristics of ketosis-prone type 2 diabetes among patients with diabetic ketoacidosis or ketosis. We use the COCO-POP and the PECO frame, and our hypothesis is that a significant number of patients don't need long-term multiply insulin injections. From almost 17,000 articles, we performed the data extraction using 10 studies. And here you can see my first result. The prevalence of ketosis-prone type 2 diabetes among patients with diabetic ketoacidosis or ketosis is 26% on average, with a wide confidence interval. And these studies that were analyzed, they are retrospective studies. They come from Asian area and the United States, where Afro-American and Hispanic patients were enrolled. There is a high heterogeneity, which I will explain later. Here you can see that this number is even higher, 37% on average, if the background population was new-onset diabetic ketoacidosis or ketosis. Here you can see the reasons for high heterogeneity. We found that if the enrolled patients were younger, then the prevalence was higher. If the studied population contained more male patients, the prevalence was lower. And finally, if the studied patients had a lower BMI level, then the prevalence was lower. And if the articles included not only new-onset diabetic patients, but previously diagnosed patients as well, then the prevalence tended to be lower. Since ketosis onset is related to type 1 diabetes, we chose this group as a comparison group. And from now on, you can see the results between these two groups. So regarding the age, we found that patients with ketosis-prone type 2 diabetes are older by almost 12 years. Regarding the BMI, their BMI level is much larger. Regarding family history of diabetes, these patients are more likely to have a positive family history of diabetes. The chance is 2.5 times higher. These studies are high risk of bias because of the small sample size. Our study provides a unique overview on the prevalence and the clinical characteristics of ketosis-prone type 2 diabetes. However, it has several limitations due to high heterogeneity, low number of participants in each study, and due to the retrospective study design. In conclusion, we have found that ketosis-prone type 2 diabetes is a common form of diabetes among patients presenting with diabetic ketoacidosis or ketosis. And these patients are tended to be older, more obese, and often have a positive family history of diabetes in comparison with the type 1 diabetic group. Since only proper classification can provide us the chance for proper treatment, the new autoimmunity markers and C-peptide measurement-based diabetes classification is mandatory to be used. If you may remember, our hypothesis was that a significant number of these patients will not need multiply daily insulin injections in the long term. However, we couldn't find an answer for this question. That's why we propose that future prospective studies are needed with higher number of patients and from the Caucasian population as well. My second study addresses these questions. We have found only one article reporting patients with ketosis-prone type 2 diabetes from the Caucasian ethnicity. And the aims of this second study is to describe the prevalence of ketosis-prone type 2 diabetes among Hungarian patients with ketotic onset diabetes, and to compare this entity to the adult onset type 1 diabetes and to the non-ketotic type 2 diabetes. On this slide on the left side, you can see the study design. Based on the presence of ketosis, autoimmunity markers, and beta cell function, we categorize the patients into 3 groups. And on the right side, you can see some preliminary results. The ketosis-prone type 2 group is marked with a gray column. And we have found that these patients are older and have a higher BMI and a higher index of hepatic steatosis. Now we are working on a decision tree model, which will help us characterize the patients based on the C-peptide level and the BMI level. In summary, we can say the strength is that this study enrolled Caucasian patients. It reports a relatively high number of patients with ketosis-prone type 2 diabetes. However, it was retrospective data collection. It is a one-center study, and only 2 types of antibodies were available at the time of the study. Absence of evidence is not evidence of absence. Thank you for your attention.
I would like to ask you regarding the positive family history that you mentioned. So what's included in this phrase? I mean, the type 2?
Any type of diabetes was included, yes.
Okay.
As a pediatric resident, my first question that comes to mind, was the pediatric population involved in the meta-analysis?
Yes, in some articles the age range was from pediatric age as well, so they included children and adolescents as well.
And can you tell me an average prevalence of ketosis-prone diabetes in the pediatric population?
Unfortunately, we did not perform a subgroup analysis for the children because there is not reported which or how big the children and adolescents proportion was in these studies.
But I would like to ask you whether you considered looking at the etiological factors behind the ketosis-prone type, and, for example, look at the diet for those patients who develop this, and maybe to compare it to those who didn't develop this type?
Unfortunately, as I mentioned, this was a retrospective data collection. We examined these patients years ago, and they were referred to our center because this is a tertiary center, and we did not follow all of these patients. So unfortunately, we don't have data on etiology, and unfortunately, I think we can do this now.
If I understand it correctly, you are investigating prevalence in connection with this type of diabetes, and are you including children in this analysis?
No, our department only sees adults, so all of these patients were above 18 years old.
And could it be a plan to work with pediatric institutes? And
this is a very nice suggestion, because with the growing prevalence of obesity, I believe there is a growing prevalence of ketosis-prone type 2 diabetes among adolescents as well. So it would be a nice project.
Do you think, is there any importance of the race? Is there any difference in Caucasians, in Hispanic, Asian population, African population among the prevalence of this type of diabetes?
So far, we believe there is a difference, because we did not have data from the Caucasian population. So we believe this is a form of diabetes of the African Americans and Hispanic patients. But now, with our study, we hope that we can call the attention that this type of diabetes exists among Caucasians as well. So maybe the ethnicity is not a important factor behind the development of this disease.
So is there any preliminary data from the Hungarian population regarding the prevalence of this?
Yes.
I missed it maybe then.
I showed it. Yes, sorry, I didn't mention the exact number. So from these 181 patients, we found that 22 patients had ketosis-prone type 2 diabetes.
So it's a little bit less than the Asian and the other population
yes.
you showed in the first study, right?
Yes, but this was not consecutive enrollment, because these patients were referred to our center from other hospitals. So this is a bias.